Hi, I'm Dr. Joel Cherdak, president of Houston Regenerative Medicine. One of the questions we get asked very often by patients inquiring about our stem cell therapy procedures is, my doctor told me that I'm going to need to have a hip replacement. Can stem cell therapy be a good alternative for that procedure? So the short answer to that question is yes, we treat patients that have been told that they need a hip replacement all the time. But there's a number of factors that we have to take into account when evaluating patients to determine if this is indeed a good alternative and if we're going to get results that are just as good or better than having a full hip replacement. There's a few things we look at. One is going to be the degree of degeneration in the hip. So patients are often told that they need a hip replacement procedure because they have, quote, bone-on-bone arthritis. So that's kind of misleading. Bone-on-bone arthritis doesn't really mean that there's no cartilage in the joint. It just means that the cartilage on the head of the femur, where it sits in the socket with the hip, is worn down so much that you can barely see on x-ray the joint space. Doesn't mean that there's true fusion of bone on bone. So as long as there's movement in the joint, as long as there's some cartilage in the joint, we can grow that cartilage and we can repair that joint by regenerating it. By using a combination of either your own stem cells taken from your hip and from your fat, or using donor umbilical cord cells, or a combination of both of those, and including PRP in that, we're able to inject that combination into the hip joint so that it can regenerate the tissue. So it will regenerate bone, cartilage, tendon, the meniscus, and some of the other soft tissue structures in the joint space, while also stopping the degenerative process and removing the inflammation that caused the degeneration in the first place. Now, not every patient is going to be a good candidate for this, and not every patient is going to get 100% full pain-free recovery in their hip joint. But we do make significant improvements, and for a lot of people, that's still going to be a better alternative than a full surgery and rehabilitation from a hip joint that also doesn't give you 100% function and 100% recovery. So we let our patients know up front after we do an evaluation what we think the degree of improvement is going to be. And for some patients, that is going to be 90 to 100% pain-free increase in motion. For other patients, it's going to be less than that, but we let the patient decide, is 50%, is 60% still going to be a better alternative than doing a hip joint replacement procedure. The other benefit of doing a stem cell procedure instead of doing a hip joint replacement is that we can redo the procedure a few years down the road, which is a quick 1 to 2 hour procedure in our office and get the same results. Whereas as the hip replacement hardware starts to wear down, again, these things only last maybe 15 to 20 years, you're going to have a whole nother hip replacement procedure. And that's really not optimal for most patients, particularly younger patients that are going to expect to live more than another 20 or 30 years down the road. So if you're interested in finding out if our stem cell procedure for hips is a good alternative to a joint replacement surgery, reach out to our clinic. One of our patient coordinators will get you set up with an evaluation and consultation, and we can let you know exactly what we think the outcome will be.